Governor, you have said you would do it on day one with an executive order that would free the states up to opt out, waivers essentially, to get out of their program. Help me understand as you do that, how would it play out?
Well, first of all, the executive order is a beginning process. It's one thing, but it doesn't completely eliminate Obamacare. It's one thing I want to get done to make sure that states can take action to pull out of Obamacare. But number two, we have to go after a complete repeal. And that's going to have to happen. That's going to have to happen with a House and a Senate, hopefully that are Republican. If we don't have a Republican majority, I think we're going to be able to convince some Democrats that when the American people stand up loud and clear and say, we do not want Obamacare, we do not want the higher taxes, we do not want a $500 billion cut in Medicare to pay for Obamacare, I've laid out what I'll replace it with. First, it's a bill that does care for people that have pre-existing conditions. Secondly, I'll allow people to own their own insurance rather than just be able to get it from their employer. I want people to be able to take their insurance with them if they go from job to job.
Can you get it repealed in total? Sure. You have to elect a House, a Senate, and a president committed to that. It has to be a major part of the fall campaign. And I think that, frankly, on our side, with any of us, it's going to be a major part of the fall campaign. But let me make one observation. You raised a good example. Why is President Obama for young people being allowed to stay on their parents' insurance until 26? Because he can't get any jobs for them to go out and buy their own insurance. I have an offer to the parents of America. Elect us, and your kids will be able to move out because they'll have work.
Problem is that two of the people up here would be very difficult to elect on, I think, the most important issue that this country is dealing with right now, which is the robbing of our freedom because of Obamacare. Governor Romney tells a very nice story about what his plan is now. It wasn't his plan when he was in a position to do a plan. When he was governor of Massachusetts, he put forth Romneycare, which was not a bottom-up free market system. It was a government-run healthcare system that was the basis of Obamacare, and it has been an abject failure, and he has stood by it. He stood by the fact that it's $8 billion more expensive than under the current law. He stood by the fact that Massachusetts has the highest health insurance premiums of any state in the country. It is 27% more expensive than the average state in the country. Then we have Speaker Gingrich, who has been for an individual mandate, not back when the time that just was heritage was floating around in the 90s, but as late as comments since 2008, just a few years ago. He stood up and said that either should have an individual mandate or post a $150,000 bond. How many $150,000 bondholders do we have here who can post a bond for their health insurance? These are two folks who don't present the clear contrast that I do, who was the author of health savings accounts, which is the primary basis of every single conservative reform of health care.
So much of what the senator said was wrong. Let me mention a few other things. First of all, the system in my state is not a government-run system. 92% of the people had their own insurance before the system was put in place, and nothing changed for them. They still have the same private insurance. And the 8% of the uninsured, they bought private insurance, not government insurance.
In fact, over half the people that came on the roll since you put Romneycare into effect are fully subsidized by the state of Massachusetts, and a lot of those are on the Medicaid program. So the idea that you have created this marketplace and with this government-run healthcare system where you have very prescriptive programs about reimbursements rates, you have very prescriptive programs just like what President Obama is trying to put in place here.
The gentleman asked whether he thinks we can repeal Obamacare. Theoretically, we can. The likelihood isn't all that good. We can diminish some of the effect, but I'm more concerned about a bigger picture of what's happening, and that is government involvement in medicine. I had the privilege of practicing medicine in the early 60s before we had any government. And it worked rather well, and there was nobody out in the street suffering with no medical care. But Medicare and Medicaid came in, and it just expanded. But even when we had the chance to cut back on it, when we had a Republican Congress and a Republican president, we gave him prescription drug programs. Senator Santorum supported it. You know, that's expanding the government. So it's endless, and most of them are bankrupt. Prescription drugs, they're not going to be financed. Medicare is not financeable. Medicaid's in trouble. But nobody talks about where the money's going to come from.